Namaskar and a very warm welcome to this edition of the Phone In program. I'm Nidhi Kumar and you're watching India Science. Well, India is home to the largest child population in the world, with almost 41% of the total population under 18 years of age. The health and security of the country's children is integral to any vision for its progress and development. 90 crore vaccine doses have been administered in India so far. In this phone-in program where you can ask your questions, we take your queries live. So today we are joined by Dr. Rajeev Seth, Medical Director, Child Health and Development Center at the All India Institute of Medical Sciences, New Delhi. Namaste, Dr. Seth, and welcome to the program.
Namaskar.
Thank you for joining us. I'd like to begin with one question, sir. Which are the vaccines still in the pipeline as far as children in India are concerned? What do we need to know about vaccines for children?
Okay, the only vaccine for children today which has received emergency use authorization is by the Zydus Catalog company. This is called Zycovid, and this has received emergency use authorization in August. And in next 1 or 2 months, we should have it for children over 12 years of age. This is a DNA-based, plasmid-based vaccine, and this has been developed indigenously in partnership with Department of Biotechnology, Government of India. So we are very proud that this vaccine will be used finally. And the best for children is that it is used in a simple plug and play technology, and there will be no needles involved, and you introduce the DNA which will generate the spike protein and then antibodies against this disease, the COVID. So there are 3 doses that have to be given. So this is one of the vaccines. The other vaccine, which is going under trial in children from 2 years to 18 years, is Covaxin, and also the Covishield are trying this vaccine in children. So hopefully, and with more time, you will see more vaccines available for children.
Thank you so much for that explicit answer. We're now joined by our first caller. Alok Mishra joins us from Mumbai. Namaste and welcome to the program. Alok, please ask your question.
Namaste, ma'am. Namaste, sir. Sir, I have a question. How prone are babies, infants and toddlers to coronaviruses? Children are said to possess more immunity. Is that true?
Yes. This is what we have seen over the last more than 1.5 years, that the children possibly are less symptomatic. They don't get very severe COVID disease. It's possible children are missing antigens on which the virus binds due to their age, or could be other factors. So children, what we see is usually mild disease, or they will be asymptomatic with no symptoms at all. And that is the saving grace, because in a way, we are seeing a lot of children who are, if you test them with antibodies, they have now got antibodies without any evidence of clinical disease. But having said that, children also get severe COVID, and the government of India has classified the COVID symptoms in children into mild, moderate, and severe category. Mild are those symptoms which could be just low-grade fever, mild cough, cold, and it subsides. Moderate is when these symptoms are there, but there is a dip in the oxygen saturation below 94%. And the severe COVID are those which have not only got dip in the oxygen saturation, but they have shock-like symptoms, which is also called like a Kawasaki disease, in which a person can get into shock. The entire blood vessels, the cardiac systems, you could have low blood pressure. And these children are very rare, less than 1%, and they actually need hospitalization. So this is the entire spectrum. But the best part is, even in the wave 1 or 2, the children who are affected were less. And so I think we should hope that even in the coming third wave that's anticipated, the children are not going to be majorly affected.
Absolutely. Thank you, Dr. Seth, for that answer. We're now joined by our next caller. Satyam joins us from Kerala. Namaste, Satyam. Please ask your question.
Hello, ma'am. Hello, sir. Sir, is the testing for COVID-19 the same for adults and children? Could the testing result be less accurate for babies?
Not really. Yeah, the testing is done in both in the similar manner. You're right. Whether it's, there are tests which are really the hallmark is the COVID RT-PCR test, and the technology is the same. And you also have rapid antigen tests, but I think the COVID RT-PCR is the one that is absolutely the diagnostics, and the prevalence of positivity is same, except if the sample is not taken properly, the child is not cooperative, or there could be other technical reasons.
Doctor, another caller on the YouTube asking us about the Delta Plus variant and what we are seeing in India and abroad. A lot of children in UK are being infected. Why is that? Could you please throw some light on this?
Yes. So what happens is this virus mutates. Now you have Delta and then you have Delta Plus. So, we are now reaching, 90 crore vaccinations. So we still have a long to go, and this is 90 crores in one dose, so 2 doses. So vaccination is the only way that you could prevent this disease. But there's usually a fight going on between the virus and the patient, and the virus mutates in order to manifest its disastrous effects, the symptomatology. And we all know this happens in almost whether you talk of influenza virus or other respiratory viruses, they keep mutating. They change the genetic materials, and it is when this Delta variant came and this Delta Plus variant, a lot more patients got infected. The Delta variant was found to be more infectious, more spreadable, and you have already seen the devastation which occurred with the wave 2. So certainly this needs to, but for now, we feel that whatever vaccines we have, they're adequate. But there is a India consortium by the government of India, which is continues to see the genetic and the changes in the variants over a period of time, and then develop changes in the vaccines as well in order if need be. So that process is going on very effectively from the side. But certainly we have to be mindful that we need to use, even if we have vaccinations, we need to use all COVID precautions. That means we have to wear a mask, we have to do hand sanitization, and keep the social distancing on.
Yes, Dr. Seth. Joining us now is Pallavi from Delhi. Yes, Pallavi, welcome, and please ask your question.
Hello, ma'am. Hello, sir. Sir, my question is about dengue, that a lot of dengue cases are being reported in infants and young children as well as adults today, nowadays. So how do we know that it is different from COVID, since it is also a severe flu-like illness? And can you please also tell some precautions?
Right. So, dengue, we have seen it much earlier. We have more experience in dengue than with COVID. And dengue occurs in the rainy season, so just soon after the rains, and it occurs due to the bite of a mosquito. And the dengue, the fever is much severe, higher grade, and it leads to body aches, muscle breaking, or bone breaking fever, continue for 5 to 7 days. And in dengue, they could have thrombocytopenia or decreased platelet count. So that itself needs to be monitored in the second half of the dengue this thing, and that is the major culprit which causes mortality or death because it leads to low platelets, so leads to bleeding from various sites. But COVID is only a respiratory, so you would have fever, you would have cough and cold. Fever will not be initially so high grade, but it could be also. But cough and cold more common in coronavirus than in dengue. dengue with fever, body aches is well known, and then rashes will appear. And the only way when you suspect, and especially you have to look at the hallmark of suspicion is the period of time. Like you said, mentioned in August, September, this particular season, post rains, we are getting this fever. So whenever we have an index of suspicion, we do a dengue NS1, which is a rapid diagnostic test for dengue, which is a blood test, and we are able to pick it up. And certainly, then we can monitor this patient for if the patient gets any low platelets also. So it's the index of suspicion of the physicians to see, which you're able to pick up. In COVID corona, usually if a child comes, usually the child gets it because of an exposure. If there's a history of exposure with coronavirus, we could look into it to an RT-PCR diagnosis as a coronavirus infection. But yes, it's very important. And many times we're also seeing a lot of typhoid fever now. And that comes from food and water. And also in the first week, typhoid fever will not have any symptoms, just high-grade fever and body aches and all. So all these are tropical fevers, and we need to be mindful that we need to not miss out and properly diagnose these cases. So the bottom line is that you need to consult your pediatrician, your doctors, and they will make a test as needed based on their index of suspicion.
Absolutely. So one must go ahead for the testing. Joining us now is Vandita from Noida. Please ask your question, Vandita. Welcome.
Hello, sir. So my question is, what exactly is the role of boosters for COVID vaccine? Tell us the science of it, as abroad it is happening.
Okay. As you know that the science of COVID vaccine is an evolving subject. As far as your question is on boosters, right now, most of the vaccines that we're using, whether Covishield or Covaxin, we need only one dose booster. So you give one now, and then after a few weeks, what the booster does is it boosts the immune response, and it creates a memory of infection. And when a virus strikes you, you could, through that memory, produce hyper immune response and conquer the virus. So this is the role of the boosters. Now, whether you need a third booster or the fourth booster, that research is still ongoing, and the data is not right now clear for our country. So I think we will have to wait and watch what the scientists actually who are following the epidemiology of the disease and seeing if there is a need, it will be announced. And I think I'll look for that information myself.
Thank you, sir. And we're joined by Mr. Kaushal from Bangalore. Please ask your question, Kaushal.
Hello, ma'am. Hello, sir. Sir, I have a question. There is evidence that there could be a post-COVID syndrome in children. How serious is this?
I think he means long COVID.
Long COVID. Is that what you're talking about? Yeah. So, see, long COVID we are seeing in adults mostly, and people with comorbidities, with advanced ages. We don't have so much of experience of finding long COVID in children. But certainly, yes, it can occur. We should keep a close watch. Usually, a standard COVID will not last more than about 2 or 3 weeks max. But if it occurs, it needs to be monitored. We are all the time watching and observing these children. The children that I've seen in my practice with COVID have resolved in a period of 1 or 2 weeks. So I haven't seen any case of long COVID in children. But certainly this is an emerging problem, and we need to keep in mind that whatever symptoms we are seeing in adults could be replicated in children, and we need to take care and report it to the authorities as and when we see them.
And be mindful of that. Rohini now joins us from Ruhi joining us now. Yes, Ruhi, please ask your question.
Hello, sir. Hello, ma'am. So my question is that the symptoms of COVID, are they different in babies and adults?
Yes, in lots of ways. When you see babies, probably you would mean less than 1 year or less than 2 years. Children below 1 year are called, these children, they are actually called infants, children who are less than 1 year. And they are, because they cannot tell, and children between 2 to 3 years are called toddlers. And they are not able to tell their symptoms. We will see fever, we'll see irritability in children, younger children. We'll see children will have anorexia, lack of appetite, and the physicians will need to have a high index of suspicion in such cases. Certainly, if there is a history of adult COVID and then this child has symptoms such as fever, irritability, cough and cold, we must have that index of suspicion. Must watch because saturations get decreased only during the moderate to severe COVID. And certainly children are not able to express, but certainly these symptoms of irritability, lack of appetite. Sometimes children also, I've seen GI symptoms, would vomit, would have abdominal pain in COVID. So these are few subtle differences that we see in children.
Absolutely. Joining us now is Rashi from Delhi. Please ask your question. Welcome.
Hello, ma'am. Hello, sir. I want to ask, can a COVID-19 positive mother transmit virus in a new?
Basically, she's asking whether a COVID-19 positive mother can breastfeed her child. Is it advisable or not? What are your opinions about this?
Okay, all right. See, if a mother is COVID positive, we are not separating mothers from the babies. And if child is very young, 1 or 2 months, it's very, very difficult because the child is 100% dependent on the mother for breastfeeding. So the mother should use all COVID precautions, use sanitization, mask, and not cough in the child, but certainly breastfeed. Certainly there is a possibility, but not feeding the baby is breastfeed is not good, and so we are not stopping breastfeed if the mother is COVID positive.
It is important to carry on breastfeeding is what Dr. Seth is advising. There's a question flashing on the YouTube by Ravish from Hyderabad, and he's asking, can a COVID-19 positive mother transmit virus? And can you also throw light on the clusters in Maharashtra and Kerala that children are falling ill after going to their respective colleges and schools in Bengaluru and Maharashtra? There have been basically 60 children and 30 children found COVID positive. Why is this happening, Dr. Seth?
Yeah, so you see, this is because of these viruses, which are very, very much more infectious, and children are not vaccinated. And children stay together in a school setup or younger children in a college setup. They're very, very hardly you will see social distancing or COVID precautions and behavior. Children so far are not immune, we know that. They have not received vaccinations. So there is likelihood of spread is there. And therefore, as we are going to open schools, it's important that we use different models depending on which part. So if you are in Kerala and you are in Maharashtra where a wild COVID strain or a new strain is coming up, you have to be extremely cautious rather than at other places where the incidence of COVID is less than 5% or so. And there, if you allow schools to open, then it should be done half and half. It could be a hybrid approach that the children are half the children are attending the class, half are online, and proper distance is maintained. Certainly, the pockets where you have found these children, so many are infectious, you need to investigate if the COVID norms are followed, what precautions, and gain from that experience, and not repeat if there are any mistakes, not repeat if in other regions when we open the schools.
Absolutely. Joining us now is Roshni from Mumbai. Yes, Roshni, please ask your question.
Hello, ma'am. Hello, sir. So I wanted to know, can we go to the hospitals for routine checkups, of children like getting their polio shots or measles vaccine, or is there still a danger of getting infected?
No, absolutely. You've asked a very good question. You should go and take your children to get their routine immunizations. What we saw in the COVID times, the parents stopped coming to the clinics in the government-approved vaccine centers, and there was a decline in routine vaccinations in children. The children are very susceptible to other infections. All the other diseases have not gone away. They are very much there. And if the children are not fully vaccinated, they are going to get other diseases. Like you mentioned, DPT, polio, these are in the first child has to have at least 3 doses of DPT, injectable polio, HIB, hepatitis B. These vaccines need to be given at around 9 months. MR, measles, rubella vaccine, and later on a booster DPT is given at 15 to 18. It's extremely important that you go and take the vaccinations, especially in the areas I've seen in the rural areas where I work with an NGO setup, that the incidence of vaccine uptake was reduced to only 12 to 13%, which will lead to a lot of indirect effects of COVID. The children are going to get diseases, and therefore we have to be mindful. We have to go and must take vaccinations. It's extremely important. The indirect effects of COVID are also seen in children because in the smaller settings where children were usually going to the Anganwadi and schools, they used to get midday meals. So if they're not in the schools, they're not getting midday meals. So one solid meal, which is many times 50% proteins, 33% of total calories, they are not getting. So we are seeing a higher incidence of malnutrition happening in these children who are, in the COVID situation. So I think we need to prevent all these and not neglect children's health, and must go and take vaccinations, take care of their nutrition for sure.
Absolutely, sir. As we speak, malnutrition is a huge problem in India, especially after the COVID pandemic. And what you said, I totally agree that a lot of children are missing out on their midday meals. Joining us now is yet another caller, Sujata from Meerut. Please ask your question.
Hello, sir. So my question is that could you please tell us about new coronavirus variant, that is MU variant?
See, the new corona variants, the Delta Plus, the other variants are just coming up. And depending upon which region is there, where you are, the health authorities are screening and looking into that. I want to create a stress situation here by eliminating new possibilities and new challenges. But what I would like to send a simple message to everybody, that you must use COVID precautions. That is the only way to protect. And still, I've seen, I'm based in Delhi, and if I go 60 to 70 or 80 miles away from Delhi, there's nobody wearing masks, there's no COVID precautions, and there are gatherings, social functions, and everything happening. Now, this is something very, very serious, and a message should go through this channel that this should not be permitted. We have had a wave 2, and that was because we did not follow proper COVID precautions. And it is anticipated the third or the fourth wave will eventually come with these new variants you just mentioned. So we have to be very, very careful. And at this point of time, children cannot be vaccinated, but adults and all the parents must take vaccinations. The school teachers, the school attendants, where the children are likely to go, they must be fully vaccinated so that they do not transmit the infection to the children.
All right. Joining us now is Amrita. She joins us from Gujarat. Please ask your question, Amrita.
Hello, sir. My question is, I was curious to know if a mother is diagnosed with coronavirus or has a mild case of it, can she still breastfeed? Because normally it is considered healthy to breastfeed when a mother has a cold because of the presence of antibodies. Is it the same situation with coronavirus?
Well, I've already answered this question by another caller that breastfeed should be continued with all the due COVID precautions from the mother. Breastfeed provides lots of benefits to the baby. Gives immunoglobulin, is able to achieve bonding with this thing, is able to get the best nutrients and micronutrients, and therefore it should not be stopped during COVID.
Another question flashing on our YouTube now is about the Sputnik vaccine. Callers are wanting to know how many doses of this vaccine, if you could throw a little light on that for children.
Well, as of now, the Sputnik vaccine is not given any emergency use, so I will not take a call on this. We are going to be talking about the Zydus Cadila vaccine, which has received the emergency use authorization, and if you wait for the news, hopefully Covaxin and later Covishield. I think we'll reserve this question for now.
Question coming is if a child has congenital heart disease, then the child is 14 years old. Can the child go in and take a vaccine?
Absolutely. Children who have comorbidities, including congenital heart disease, are at risk, and they should take the vaccination. There's also children who have special needs, children who have disabilities, and they need to go and take vaccines when the vaccine is available. Children who have other kinds of immune deficiencies, diabetes, cancer, are being subjected to treatments, immunosuppressive. Well, so far what we have is that we should give priority to these children and get them vaccinated.
Is Khushi, and she joins us from Lucknow. Yes, please ask your question, Khushi.
Sir, my question is that can you give please in tips for building a child's immunity at home? Like nowadays, it's very important to build the immunity. So can you give some tips?
So immunity build-up is extremely important. I think that as soon as the baby is born, if I will talk the first 6 months, the baby should be breastfed. Breastfeed initially few days as colostrum, as immunoglobulins to build the immunity. So that's the best way. And I think through this channel, I must say that the first 6 months, exclusive breastfeeding by Government of India or WHO, it's a standard norm you should follow. After 6 months, the child should be given complementary foods. Should start with some proteins. Could be home-based diet. Could be rice. Could be mixed with dal and other kind of vegetables and fruits as the child is able to tolerate more and more. Depending whether you're a vegetarian or a non-vegetarian, egg yellow is also good for getting has got extra yolk, has got lots of lipids and calories, and the weight gain is better on that. But we prefer that you don't give egg whites to the children in the early this thing, and we also prefer that cow's milk is not given. So certainly other semi-solids, once they are started, they are called complementary feeds. And as the child becomes bigger, 1 to 3 years, it becomes a toddler, the child should be fed 6 feeds a day, hopefully breakfast, lunch, dinner like we take and extra. And it should not be any junk food. So nutrition is extremely important. High protein diet is very important. And vaccinations are the most important way of creating. So the first 2 years, child needs a series of vaccinations. And like mentioned earlier, it should not be missed because there is COVID happening or we are in the midst of a pandemic, because vaccinations will build the immunity. And treatment of infections is extremely important. Prompt attention to the children is extremely important.
Absolutely. So one last question before we leave, as we're running out of time. If a child is diagnosed with thalassemia, can the child go in for a vaccine is a caller's question, sir.
Yes, thalassemia is a hemoglobinopathy, and where it could be minor or major thalassemia, and these children should be vaccinated like any other child.
Absolutely. And on that note, I'd like to thank you, Dr. Rajeev Seth, for joining us on this program. With this is the wrap of this edition of the Phone In. Don't let fear of getting the virus that causes COVID-19 prevent your child from getting his or her vaccine as and when they are available. And this is in order to prevent any other serious illnesses. Do go and visit the doctor for your timely checkups. The guidelines to prevent the spread of the COVID-19 virus can be particularly difficult for kids, but stay patient, be a good role model, and your child will more likely follow your lead. On that note, many thanks for watching. Namaskar.